Sexual transmission from two recent raves in Europe may explain the recent monkeypox outbreaks, according to World Health Organization expert David Heyman. Heyman, who called the outbreaks a random event, said the raves held in Spain and Belgium are the leading theory to explain the disease's recent spread, according to Hill reporting.
There is one confirmed case of monkeypox in the United States and 4 suspected cases in the country, the CDC said yesterday. U.S. health officials are in the process of releasing some Jynneos vaccine doses for use in monkeypox cases for high-risk people. Dr. Jennifer McQuiston, Deputy Director of the Division of High Consequence Pathogens and Pathology within the CDC's National Center for Emerging and Zoonotic Infectious Diseases, confirmed that there has been a request of the release of the Jynneos vaccine from the national stockpile. McQuiston said the U.S. has a good stock of that vaccine because it has been preparing for the possibility of needing to use the doses for smallpox, according to CNN. Senior scholar at the Johns Hopkins Center for Health Security, Dr. Amesh Adalja, joins us to discuss. Welcome, Dr. Adalja.
Thanks for having me.
Okay, so what should people know? This is obviously a very scary sounding thing, given that we're all reeling from the consequences and a lot of the misinformation and confusing information that we're getting about COVID. Help to clarify for the audience who wants to know how concerned they should be in this moment.
There's a natural tendency for the general public and the press to view every infectious disease emergency post-COVID through the lens of COVID. But you sort of miss a lot of the differences between the viruses. They're distinct biological entities. Monkeypox is a virus that's been around, at least noticed since the 1950s, has been infecting people since the 1970s, primarily endemic in certain countries in Africa. And we've seen sporadic cases occur with importation. And what's happening with this outbreak is that this illness, which causes fever and rash, is spreading within social networks in a way that it hasn't before. But it's something that we know how to contain. The key thing was just understanding the epidemiology of how people were getting infected. And I think we're getting closer every day to really getting a handle on how people got infected. And we can then deploy the Jynneos vaccine or other smallpox vaccines to halt transmission, just like we've done with prior monkeypox outbreaks that have occurred, including in the United States in 2003.
Do we know that it is primarily sexually transmitted, or is it's transmitted via close sustained contact, including during sexual behavior?
We don't know that now, but we do know that skin-to-skin contact, close intimate contact, even if there's not per se sexual transmission through body fluids, is enough for this virus to move from person to person. So for control measures, it's not necessarily going to be any different if it's being transmitted sexually or being transmitted through sexual contact, because we still do the same thing. It's an important scientific question to understand, is the virus in the body fluids that are exchanged during sex? And I suspect it probably is, but a lot of this might just be skin-to-skin, close contact, based on what we're hearing about lesions being concentrated in the genital regions, for example.
And regarding the vaccine, my understanding from reading about it is that so they can give the vaccine to people who maybe are close contacts of people who've been infected, so that to try to stop them from getting it, and that also you can give the vaccine as sort of a therapeutic to someone who has been affected, and it will help them. Is that accurate?
Sort of. We use the vaccine as what's called post-exposure prophylaxis. So we have a case, and then we identify the contacts, and you can vaccinate those individuals during the 12 or so day incubation period, and that may completely abort the infection, or it may make it less severe. We don't really give it therapeutically once they've already developed illness, but if you can get them in that 12-day incubation period before symptoms have started, you can significantly impact their illness and possibly completely stop their illness from happening. That's exactly what we did for the smallpox eradication campaign. That's what we've done in other monkeypox outbreaks, and that's the kind of concept of operations for this current monkeypox outbreak.
Are you surprised by the kind of appetite for the story in the public? Is this commensurate with other similar types of outbreaks that we've seen? Or do you really think that this kind of focus on monkeypox is driven by some combination of hyper awareness of viral pathogens because of COVID, and also perhaps the monkey in the name, which seems to be particularly scary and outlandish seeming to people?
I definitely think that the general public, as well as the press, are now attuned to the risk of infectious disease and see this as an important story. But again, they have to start to think about these as different biological events, not one continuous pandemic from COVID-19 to whatever comes next. And I do think when you have a zoonotic infection, meaning it comes from animals, has monkey in the word, sounds like the word smallpox, all of that does have a little bit of an allure to it. What we hope is that that the press starts to cover infectious diseases in a way that's not sensationalistic, that's not alarmist, but actually reflects the threat that infectious diseases pose to us, and helps the public become informed and interested in this topic, especially our policymakers, because preparedness is going to be very important moving forward after the COVID-19 pandemic.
So given what we know so far about how it spreads, would you, I know some people already who are like, well, we got to keep just, wearing masks outside, just in case, because it can theoretically spread through respiratory droplets. But I don't think, and based on what you're saying, we're not at the point of which like all people need to worry that they're about to contract monkeypox unless they're taking very serious precautions on the level of the precautions they took against COVID-19, which is, very, very, very broadly contagious.
Monkeypox is much less contagious than COVID-19. Though it can be spread by respiratory droplets, it's usually close contact. And the other thing about monkeypox is it's not contagious during the incubation period. So very different transmission characteristics from COVID-19. And the general public is not at risk from this monkeypox outbreak. It seems to be clustering within sexual networks of men who have sex with other men. And it's not something that's a general threat to the public, although anybody can get infected if they're exposed in the appropriate manner. So I think this is something that will eventually be controlled now that we've got an understanding on the epidemiology. It'll take some time to get vaccine into the contacts, but I don't think that this deserves any kind of alarm. And you have to also keep in mind that not every pathogen has pandemic potential. Monkeypox is not something that can cause a pandemic. It simply doesn't have the biological characteristics to be able to do so. And we have a tried and true mechanism to stop it, which is the vaccines.
Well, while we have you here, we want to just talk a little bit about COVID-19. Scientific advisor at the Broad Institute of MIT and Harvard, Alina Chan, tweeted yesterday that she heard new phrase permasurge used to describe the spread of Omicron and its subvariants in 2022. Can you update us on the status of any new vaccines that are, catering specifically to the sub-variants of COVID?
We know that both Pfizer and Moderna are trying to update their vaccine. There is talk about putting an Omicron variant in the vaccine that might be available in the fall, so it has the original strain and Omicron. There definitely is a need to update these vaccines because they're not able to block transmission the way that they could during the earlier eras when Delta was prominent, or Alpha, or the original version. There's also work to make a universal corona vaccine that would combat all coronaviruses and not have to be updated. So there is going to be a lot of innovation coming forward in this space because these first generation vaccines are not the last that we're going to see. Those are very, very effective at what they do, which is preventing serious illness, hospitalization, and death. But there's always room for improvement, and technology is going to progress.
And doctor, what do you say? What is your response to folks who have been talking about some studies that seem to indicate that there might be some concerns about waning efficacy of vaccines and boosters the more and more people take them over time, that there could be a diminishing returns or even increased vulnerability to the virus over time, depending on how many vaccines and boosters you ultimately take? Are those concerns with any legitimacy or that you've been following at all?
There's a theoretical concern that you can sort of prime your immune system to only respond to the vaccine strain, and it has difficulty being able to respond to other strains. And that's something that people have seen with influenza. And it's clear right now we're already getting diminishing returns. I don't think there's any danger to the boosting. I think it's just not a proper policy. I think we need to update the vaccine to get the appropriate protection. And we will see diminishing returns if we continue to use boosters against the ancestral strain and the immune system keeps getting hit with the ancestral strain when what's circulating is something completely different. There's going to be less and less protection as the virus becomes more immune evasive the way Omicron has.
Well, thank you so much, Dr. Adalja.
Thanks for having me.
And we will have more Rising after this.